250,000 Connecticut residents now have quality, affordable health coverage thanks to the Affordable Care Act. Christina is one of them. This is her story.
I had always had employer-based coverage. When I left my full-time job to start my business, I extended that. I kept that coverage through COBRA. And I was allowed to keep that for about 2 years. And then eventually it ran out, and that's sort of when I hit a whole bunch of problems trying to find coverage on the individual market. Before the Affordable Care Act, when I tried to apply for insurance on the individual market, I had to fill out a 15-page questionnaire for one particular carrier about anything that I had even been remotely discussed with my doctor for the past 10 years. I then got a rejection letter from that carrier that basically just copied and pasted everything that I had written down and said, these are your pre-existing conditions, we can't offer you a plan. And I found myself in a position where I didn't think that I was going to be able to get affordable insurance. As it turns out, the only option that was available to me at the time was through the state's high-risk pool. As I was shopping around for an individual plan, I thought that I would do the responsible thing. I was 40. It's about time to do the annual mammogram. So I went in for a mammogram, and the hospital called me back and said that they had discovered something suspicious in my mammogram. Well, I'm looking now at possibly not having any health insurance and being told that I may possibly have breast cancer. So many different things are going through my mind at that time. Did I have to leave my business? Did I have to sort of give up that dream of having my own business? That kind of uncertainty was very anxiety producing, and it struck me, I think, at that point how important it was that everybody have health insurance. When the website went live, Access Health Connecticut, I did my research. I took a look on their database to see what kind of plans were available to me. And at the end of the day, the exchange plan was the best way to go. I think the key benefit of coverage under the Affordable Care Act is the affordability of the health insurance. I went from paying $1,200 a month on the high-risk pool to $430 a month under my exchange plan. And now a year into having this gold level plan through the exchange, I was able to save enough for a down payment on a new house that I just closed on at the beginning of the month. I'm thankful that there was a solution for me to be able to keep my business, to have affordable health insurance, and to have insurance that was going to be there for what I needed it for and that couldn't be taken away, so that I can focus on the work that I'm doing for my clients and keeping my business growing and successful. When you are an owner of a micro business, your personal and your business finances are very closely tied together. So that kind of peace of mind is essential for me.
Connecticut residents like Christina are benefiting every day from having access to quality, affordable health coverage. To enroll in Connecticut's health insurance, visit accesshealthct.com.